councillors?
You're now live, Chair.
Thank you, Gordon. Right. Welcome everybody to actually what is our last board meeting as a CCG. So before I start, as the chair, I'd just like to say thank you for all the board members, past and present, who have contributed to the improvement of the health of the people of Rotherham. I'd like to thank all our staff who over these years, since whether they were here before, whether they joined at the start or whether they joined later on, have all become part of our CCG family and have all contributed to that improvement in their population health and individuals' health of the people of Rotherham. And I wish everyone well as they move on. And I think our behaviours and our enthusiasm for improving health will continue into the new organisations as we join them. So thank you, everybody. Janet's been in and out. Right, so with that, we'll just move on with the agenda. Do we have any apologies? Assume we have a public health apology. Looking at my list.
Not received anything, no.
Okay. We are quorate. Any declarations of interest above and beyond the normal GP declaration of interest? Nope. Have we got any patient or public questions? Take that as a no.
Sorry, Chair, I can't find the unmute button. No, we've not got anything.
Okay, let's move on to the draft minutes from March. So for accuracy and anything that arising that's not on the agenda, page 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, we shall take those as an accurate record. Thank you, Lindsay. Okay, action log. I think my action is complete. We're actually doing a final talk with all GPs at our next primary care learning meeting, and also we will be attending a meeting with the council to talk with the councillors about GP access. So that can now be green. Transition approach is on the agenda, and we'll just
that's complete, that action now, Chair.
Okay. Ryan, did Stuart send you the right stuff? Or are you still on mute? Oh, no. Still on mute, Ryan.
Sorry, I haven't received it as yet.
Okay. We'll continue to bug Stuart to get you the stuff.
Yeah, I think he's got the data, but he hasn't sent it to me. So I don't know if someone can chase him.
Okay, and then the last one about GBAF, Ruth.
Thank you, Chair. That was fed back into the last OE discussion.
Okay, fine. So just Brian's one and everything else is green. Okay. Chris, over to you, Chief Officer's report.
Thanks. My last Chief Officer's report then, Chair. I suppose just for note, we do have an exceptional meeting for year-end accounts, just for reference. But yeah. So I'll just go through, like I normally do, just go through methodically. I'll just stop at the end of each item. If anyone has any questions, just stick your hand up or just let us know. So the first one's really an administrative change. There was a change to legislation around CCG governing body membership. It wasn't an issue for our governing body because we still have a full complement and a full membership. But as CCG's transition, some areas were struggling with membership and choracy, so there was an adjustment. So for completeness, we've put it in the papers, but like I say, not an issue for our organisation. The next is a change to the infertility policy. So access to these services is something that does get reviewed regularly as the science gets updated and we work through. There's been a slight change in wording that there's been proposed that's in the paper. I won't read it out, but it's there for people to see. We tend to do this en bloc, the 23 CCGs across Yorkshire and Humber, we act together so there isn't a postcode lottery between access to services. So it's helpful if we all agree at the same time any amendments. This amendments will be going to all the organisations. So it's only a minor amendment, but obviously an important one. So if people are comfortable, if we could minute that we're happy with that amendment, that would be very helpful. But I'll just pause to see if anyone's got any issues with the suggested amendment. Okay, so if we can just record that. Sorry, Chair.
So people just need to show assent that we're happy with it. That's fine. Yeah, I can see everyone has said yes, Chris.
Okay, thanks everyone. So if we can just record that we support that amendment to our policy, and we'll change that and update to ensure we're consistent with the other areas across Yorkshire and Humber. The third update is the Rotherham Safe Space update. This is something we've had previously at governing body, and it's just to update on the procurement of an alternative crisis service. So a contract's been signed between Rotherham CCG and Touchstone, following all the normal procurement processes which you'd expect. And it's with a firm that's got a track record of providing these services. So this is here for completeness, so governing body can just see the complete process in line with our policies and procuring new services. Okay, next is a on-call test. So as a category 2 responder for emergency planning and response, we have to test out our processes, and Ruth has overseen a test which was completed in March, and everything went to plan, and we can be assured that our processes are robust and working as we would wish. The next is an Ockenden update. So just the background to this is Shrewsbury and Telford Hospital, there was some failings which were investigated by Donna Ockenden, which came through. There was an interim report that came out with 7 immediate and urgent recommendations, immediate and essential recommendations even. And this is the final report, which I think has 15 final recommendations in. In terms of Rotherham Hospital, Rotherham Hospital is currently rated CQC good for maternity, and this is not a service we have any major concerns with. However, we will be conducting a visit with NHS England, the local maternity system. I think myself and Sue, will, as chief nurse, will be present as well on the day. And we'll be going through assuring ourselves on May the 25th that Rotherham Hospital is making the progress we'd wish on the 15 immediate and essential actions. So I have nothing to flag up at this stage as a concern, but we'll just seek further assurance and we'll report back if there should, well, I don't know how we'd report back. We'll report back through the necessary governance, which we'll need to determine if there are any concerns. But as I sit here today, the trust is currently rated green or amber on all the 15 actions, so there are no reds to report. Just onto the communications update. Again, we've got the transition to the integrated care board, both internal and external. So we're reviewing all the comms channels. We'll review the website from the 4 CCGs coming through to an ICB website. That's something Gordon Lader will be working with colleagues across South Yorkshire to fine tune and streamline all our comms approaches and media approaches and website approaches to liaising with the public. So it may well be there'll be a bit of rebranding and a bit of go through. So a public facing message will be the CCG website, work in progress to make that work as an integrated care board website. Nothing else I was going to flag up as part of that, but if anything else and anyone has any questions or anything to ask, please fire away.
Okay, any questions there, Chris? It's a fairly comprehensive report. Thank you, Chris, for all your chief officer reports over the years. You've got a couple of next agenda items still yours. So it's the updates. Anything you need to updates from system-wide?
Yeah, so in terms of, there's a couple of things in terms of system planning and the other thing in terms of the ICB development. So the ICB is now still appointing to the ICB board members, still need to go on partner members for the board, and there's been a decision made to go for a fourth non-executive as part of the post. So apparently, up and down the country, it started off as a minimum of 2 on the ICB board, but people have gone for 3, then 4, and then when they've realised the business to be conducted, some areas I think are even going to 5. But South Yorkshire and Basset Law is currently has 3 recruited non-executives. They will be going out for a 4th. I think currently are out for a 4th. In terms of how it will work is as we transition from CCGs to the Integrated Care Board, the Integrated Care Board will meet for the first time in public or formally on the 1st of July, which they legally have to adopt all the responsibilities of CCGs, adopt policies and everything else. So all our due diligence work will need to work through and culminate on the 1st of July as we do the official handover. And that's just for John Barber, that's the business we'll conduct through the audit committee we have in our organisation to make sure we're spotless on our handing over on our due diligence checklist and make sure it's all fit for purpose. In terms of system planning and just reporting, just a couple of headlines rather than going into any significant detail. The ICB planning submission was made last week. We are currently looking at a plan we ended the year with 77 over 2-year waiters in South Yorkshire. Now, pre-pandemic, that was something you would not expect to hear, but actually we are in a more favourable position than most other ICSs, which is not something I'm proud to say, but 77 over 2 years waiters at the end of March. The ambition is to, over the next year, 22-23, to get that down to 78 weeks maximum waiting time. And we do have a stretch ambition to get that to 65 weeks as well. But 78 weeks is our ambition for this year. Lots of caveats to that around workforce and COVID waves, but we do think that's achievable if everything else is manageable. Good news on cancer. Our plan for cancer is to get to 0-62 days by the end of the year. That will be better than pre-pandemic performance. So really strong plan on cancer. The challenge now obviously to implement it. Lots of workforce issues in cancer, so we need to work through that. The Ockenden report I picked up on maternity in the Chief Officer's report. That is national priority and an absolute priority for us in South Yorkshire. Again, in Rotherham, we'll be conducting a visit on May the 25th and working in partnership with the Trust to make sure they are implementing the 15 immediate essential actions. In terms of activity, when I say activity, I mean hospital operations, elective pathways we call it, but basically from a GP referral to a hospital operation. We'd be looking at running 104% capacity in the system for 22-23 of pre-pandemic levels. So we're really pushing in terms of the business we're pushing through. The key risks we've flagged up to delivering it are workforce, which again is partly due to shortages that we had pre-pandemic, but also staff absence due to COVID infections. And also the other concern is the urgent emergency care system in South Yorkshire is running it's a very busy system across from primary care, mental health services to hospital services, social care services. The whole system is running at absolute maximum capacity and has done for a sustained period now. So that is a concern we have. It's the new normal post-pandemic seems like a very busy urgent emergency care system. So that's something we're very aware of and keeping close tabs on. So that's my system update, Chair.
Okay. I assume we've got no papers, nothing to update from the Joint Committee.
A Joint Committee, again, we were looking at alignment of policies, working through the due diligence checklist. Everything's pretty much as per our plan. There's nothing by exception to report back to the governing body. And the key milestone for us will be the audit committee we have where we'll do the final signing off of the due diligence checklist. So that's still the plan. I suppose the thing I should have mentioned under that is we had royal assent of the bill on the 28th of April. So it is now pretty certain that the 1st of July will be the transition date from CCGs to the South Yorkshire Integrated Care Board.
Okay, thanks for those updates, Chris. I don't see any hands raised. So we'll move on to Wendy, Finance and Contracting reports.
Thanks, Chair. So today we've got the month 12 position, so our end of year position, and I'm pleased to say that we've been able to report a position at month 12 in line with our forecast, so a 3 million surplus. Since the last report at month 10, the tables will show you at the start of the report that cash and payments have continued to be well managed. So we've ended the year with cash balances well below the maximum holding limit that NHSE set for us, and we've achieved 100% compliance against the payment targets. So moving on to the OCS at section 5. So that bottom line does show the 3 million surplus, which is what we expected. And there have only been a limited number of variances between 10 and 12. So we've just this month shown that as a short table. Just the one to draw attention to is prescribing, because it's the most significant individual variance. It's a result of the latest actual data, and you'll all know by now prescribing runs 2 months behind, so we've had to make an assessment of month 11 and 12, and so we have seen an increase in that, and it's just to say really that that does also pose a risk in that the actuals become available whilst external audit are on site reviewing the accounts. So it's the same as every year, that it's nothing new, but it's just to flag that if anything, that is the number that I would just draw your attention to in the report. I think other than that, we've just had some smaller ups and downs in a few other areas, including the independent sector activity, non-contract activity, and CHC. All has been happening during the whole year, and we've been able to balance everything off as expected. So if I just pause there and just ask you to note the report of position, and just note it is also brackets subject to audit. And I'll just pause there, thanks.
Thanks, Wendy. And just a reminder, because it's public meeting, that we don't actually have £3 million spare cash.
No.
It's a surplus, do you?
Yeah, it's not cash. Be nice if it was, but it's not cash.
Yeah, it's financial rules and things rather than something we would be able to spend.
It is, yeah. It's performance against an initial allocation rather than cash.
Okay. Any other questions for Wendy? Okay, thank you, Wendy.
Thanks,
we'll move on to Ian then.
Yeah, afternoon, colleagues. Can I just check you can hear me okay? Because
We can.
dealing with the connection. Yep, can you hear me all right, Richard? Lovely. Okay, so as you'll all be aware, we do this by exception in terms of performance position today. So I'll just talk you through the delivery dashboard. So a couple of things just to flag: any attendances back to the levels that they were pre-pandemic as we ran through the February position. Excuse me. So again, reflecting on Chris's point around the pressure in the system and sustained over the period and continues to be so. IAP performance, maintaining IAP performance again, but this is one area that we're keeping a close eye on in terms of presentation on mental health. Cancer performance, challenging across the board, and I know we've got some real ambition to reduce 62-day targets, but that will be a real challenge for us as we move forward. And again, we can talk more in that space. On our elective care in the place, we're doing pretty well comparative to national, but again, in order to kind of recover the elective position in the context of what has been an extended period of hospital attendance and admission for COVID through March and into April, that will remain a real challenge to get to that level of 104% of previous levels of activity. So we're currently at the 75%, a national view at 62% on RTT, but again, that will be the absolute focus as we run through that kind of spring and into the summer period. Diagnostics, in terms of 6-week wait for diagnostics, this is an area again that will be is a challenge for the Rotherham places, a challenge for all places nationally to kind of get people through diagnostic pathways in a timely manner. We continue to work closely with not just colleagues in Rotherham, but South Yorkshire in terms of solutions for kind of diagnostic activity, and that will be one of our key priorities as part of the planning round. So I hope that just gives a summary, Chair, of the kind of key areas of performance challenge, pretty consistent to the narrative I've used in previous governing bodies over recent months, as we're trying to pull out of the kind of pandemic response and into operational business, but then again in the context of quite high levels of COVID activity in our hospital over the last few months. So happy to take any comments or questions. Thank you.
Okay, any questions, comments for you? Everyone's very quiet today. Fine. Okay, we'll move on then for Sue.
Thank you, Chair. So starting with the safety and quality report, I was going to whip through this quite quickly and take any questions on it and give a briefing that I've agreed with you, Chair, giving some more detail about the Ockenden report. There is some detail, some brief detail in the report, and in addition to that, there's a range of background and actions undertaken across the whole patch. So I briefed Audit and Quality Assurance Committee yesterday, and that almost identical briefing coming here today. So the background, Chris has given some of it. The Ockenden independent review of maternity services at the Shrewsbury and Telford Hospital Trust was requested by the then Secretary of State for Health and Social Care. It was commissioned by NHS Improvement and was chaired by Donna Ockenden and commenced in the summer of 2017. The final report was published in March 22. This followed the first report in December 2020. And the independent review and reports acknowledge that the NHS has worked through 2 years of COVID pandemic, going over and above the call of duty to support and care for patients. However, it does highlight failures in services, failures to investigate, failures to learn from incidents, and failures to improve, and ultimately failures to safeguard mothers and their babies at one of the most important times of their lives. The review started with 23 family cases, but rapidly grew to include reviews of 1,592 incidents involving 1,486 families whose experiences occurred predominantly between 2000 and 2019. The first report reviewed the care that 250 mothers and babies received and outlined local actions for learning for Shrewsbury and 7 immediate essential actions, which further break down into 25 elements to be implemented both at the Shrewsbury Trust and across England. The first 7 were enhanced safety, listening to women and their families, staff training, and working together, managing complex patients and complex pregnancies, risk assessment throughout pregnancy, monitoring fetal well-being and informed consent. The second report builds on this and drives forward the importance of learning from actions, which highlights some new themes to be shared across all maternity services, these being aimed at bringing about positive essential change. In addition, a total of 60 actions for learning were identified specifically for the Shrewsbury Trust. And always remembering the impact on the lives of families of the death or serious complications suffered as a result of maternity care just cannot be underestimated. And with this in mind, the report aims to address specific concerns about Shrewsbury and Telford and to provide immediate essential actions for all maternity services across England. The 15 immediate essential actions from the second report also break down into 92 elements. So you can see it's quite a comprehensive piece of work that all trusts are undertaking across the country. The 15 out from the second report are workforce planning, safe staffing, escalation and accountability, leadership, incident investigation and complaints, learning from maternal deaths, multidisciplinary training, complex antenatal care, preterm birth, labour and birth, obstetric anaesthesia, postnatal care, bereavement care, neonatal care, and lastly, supporting families. families' voices were central to the review, and the experiences of families accessing maternity services were paramount to the formulation of the actions. The report also acknowledged the unrelenting commitment at the start of the process of the parents of 2 babies who sadly passed away to ensuring that their daughters' very short lives make a difference to the safety of maternity care nationwide. The final report, published on the 30th of March this year, includes examples of repeated failings and case summaries, which are very sad and an uncomfortable read. So if you haven't accessed the link, but either within my report or Chris's Chief Officer report, just beware that there are some quite distressing stories in there. For myself, looking at the detail of the failings in governance and leadership, there appear to be similarities across mid-staffs to the findings in the across from mid-staffs in the findings in the Francis report in 2013. We need to constantly challenge ourselves with, could it happen on my patch? We need to be aware that you should never assume that it's not possible to happen somewhere. So perhaps more importantly, we should ask, if so, if it did happen on my patch, would I know about it? And are there effective, trusted systems and processes in place to alert both providers and commissioners? The review team believed that the Trust Board and the CCG were reassured rather than assured about governance and safety within their maternity services. And this even in the presence of independent and external reports and family voices which consistently indicated that maternity services need to improve. It should be remembered that the majority, that's 90% of patient feedback, was positive. However, the 10% that was negative concerning information which needed investigation. So nationally and locally at Shrewsbury and Telford, the actions that have been undertaken have been within the learning points, and NHS England and Improvement have asked that all trusts undertake self-assessment against both the 7 immediate essential actions in the first report and the 15 in the second. The first 7 were then moderated by the LMNS, who are monitoring compliance, pulling together the assurance across the footprint and identifying gaps. And as has already been mentioned, they're putting into place a programme of visits to maternity units. Nationally, there is to be established a special health authority to continue the maternity investigation programme currently managed by the Healthcare Safety Investigation Branch, or HSIB, as you've heard us refer to it in the serious incident part of the report. And this is to be in place by April 2023. The local position is that TRFT our local maternity provider have mapped their position against the 7 immediate essential actions and developed a plan to achieve them and ensure continual improvement. This self-assessment has been agreed with the LMNS and shared with the CCG, and it is essentially the majority of those that compliance is green, with 2 areas of partial compliance and a comprehensive action plan in place to address that. The Rotherham visit, as Chris has mentioned, is on the 25th of May. Myself and the Director of Nursing Designate from the ICB will be present on that visit. The CCG is also linked into the Head of Midwifery-led work to manage the progress against the actions and to prepare for the visit, with the Deputy Chief Nurse being invited to the TRFT Task and Finish group. Our audit quality and assurance group has been briefed and briefing governing body at the moment, and it's a standing agenda item on the Chief Nurse monthly meetings that I have with the Chief Nurse at the Foundation Trust. And just a little bit on next steps, because there's only a couple of things to mention. The South Yorkshire Chief Nurses are meeting with the Director of Nursing Designate of the ICB to agree how these assurance processes will then feed into the ICB governance structures. So the next steps in terms of our future assurance, we're working out with the within the governance structures that are emerging from the ICB, and are in regular communication with both the medical director designate and the director of nursing designate about this. And that'll be really good, because that will be a blueprint for how we move forward with providing assurance across the patch in the future, because governance structures need to be clear about assurance, professional curiosity and challenge. And that was what I was going to say about that. Happy to take any questions on either that or the governing body safety report. I can see you've got your hand up, Chris.
Yeah, I was just going to say that was a brilliant update, Sue. Thank you. That was really hit the nail on the head. I was just going to add, just in terms of as much as we're obviously, Sue and the designate chief nurse for the ICB will be we're working with Rotherham Hospital to understand compliance against immediate actions. Rotherham patients do access to other hospitals in South Yorkshire. So some of our mums choose to access Doncaster, Barnsley, but many do access Sheffield as well, because the way our policy works in South Yorkshire, if you're under 28 weeks, then Sheffield's our pathway for under 28-week births. So in terms of Sheffield, it has been documented in the press recently that Sheffield has been rated inadequate on maternity. So we will need to seek assurance from Sheffield as part of this process. So Sheffield's visit is tomorrow. No, it's not. It's on Friday. And what the assurance through that will be sought through the local maternity neonatal system and through the integrated care board. But that is something, and we will be reporting back onto this board if in normal time. So that will be something that will transfer and make sure in our legacy documentation, our assurance and or concerns around maternity, will make sure that's documented as part of our handover to the ICB. But in terms of governance, I'm assured the governance is strong. It's just a case of going through the process and understanding if these immediate and essential actions are being implemented.
Can I come back on that, Chair?
You can.
So that's one of the reasons that the chief nurses are working across the patch, because we all have families who choose to access maternity services in various hospitals across South Yorkshire and Bassetlaw as well. And one of the reasons for us wanting to formulate a process for assurance collectively rather than in silo, it's really important at a local level. It's really important to be cited on that whole picture going forwards. We also have the system quality board structures, which are currently under discussion, and that's it. So we'll sit over South Yorkshire in terms of feeding up assurances about the quality of all commissioned services across the patch, and the relationship of the system quality board to the integrated care board are part of that conversation. One of the meetings to determine the terms of reference for this group, which has slightly changed its form and function as we move forward, is happening now as we speak, and I'm linked into that by the other chief nurses, and I've been involved in the planning of that.
Okay, thank you, Sue. Does anyone else want to raise anything about that? Okay. Does anyone want to raise anything on the rest of the quality safety report? Okay. Would you move on then, Sue, to the patient public engagement experience report?
Yep, thank you very much, Chair. So a collection again of what we're hearing and regional and national feedback within this report there, and a couple of links that you can access. There's a little bit about the Leeds Voices launching the asset-based community engagement toolkit and some key points from that there. The Friends and Family Test still coming back into force. I think it's safe to say it's not as easy to collect the friends and family information. And just to note that this went back into the GP contracts from the 1st of April this year. though it's not expected that data will be collected for Q1 and Q2 from GP practices. And Helen is well linked to all of that and has had discussions with the primary care team so that things are joined up in the future. I think down on, where are we, page 5, we start with some of the visual feedback from the friends and family from the trust, which is interesting to see in terms of what they felt could be done better and what some of the feedback has been to improve there. I wasn't going to add anything else. There is the Health Watch newsletter as part of that, which I try to include whenever we've got it. I'm looking for Debbie. Debbie, is there anything you want to add to that?
No, just I think everything's in the paper, Sue. I just to remind people that the ICB engagement strategy is being worked through at the moment with the idea of working with people and communities. And there's lots of opportunity for people to give feedback to the ICB about the broad brush proposals that are out there at the moment. And I think there's a link in the document about that. No, and you know, everything is busy and we continue to work with partners wherever we can. So I don't think there's anything else really to add.
Thank you, Debbie. Any questions for Sue or Debbie? Okay.
Thank you.
Move on then. Thank you, Sue. Ruth.
Thank you, Chair. The GBAF and the race register went through yesterday by Aqua in a line-by-line review of that. I'm happy to do that again today with governing body, or I'm happy to take comments overall, depending on which one you want to do, Chair.
I think we'll just take comments. We'll just hear from John. Aqua are happy and they've gone through everything.
Yeah, Chairman. So I think there was 3 main areas we were focusing on really yesterday. One was just our relative position versus other CCGs. You know, if you look at the GBAF in terms of, if you like, performance and how we compare with others and the relative position there, which is generally quite good, really. So we were looking at that. We're also looking at delivery against our risk appetite and whether there was any more actions we should be taking where we're not achieving against the risk appetite level, and whether there's a bit more actions we should take where the risk score is still quite high. So we looked at 1 or 2 areas around that, but recognising that relative position. And the final thing is what happens to our GBAF in the future, and how we maintain. You know, we sort of feel like we've got a very good practice, GBAF. We developed it. Well, I say Ruth's developed it a number of times over the last couple of years and improved it, and it works really well, I think, in terms of giving us a focus of actually reviewing our assurance levels. So what happens to it in the future? And I think that'll be obviously subject to, it'll depend on what the ICB put in place really in terms of their own assurance frameworks. But we're keen not to lose some of the good practice that's in our existing GBAF. So I think those were the main 3 things that we talked about yesterday.
Okay, thanks, John. Are there any questions or issues anyone wants to raise? No? Okay. Corporate assurance report then, Ruth.
Thank you, Chair. So this is the last corporate assurance report we're producing for Rotherham CCG, and nicely completes Q4's assurance. I'll take it as read and happy to take any questions on that.
Okay, any questions? Anyone want to raise anything? Okay. We'll just move on then. There's minutes from the other meetings. Just whipping through those. So ICP Place Board, Ian.
Yeah, nothing really to flag there, Chair, just information.
Okay.
Thanks.
Primary Care Committee, Janet.
Sorry, Chair, I couldn't get it to unmute. These are, I mean, they're here for information. I'm happy to answer any questions. Now, the primary care minutes from March, just to give you some headlines. We updated, we got an update around dementia. We agreed the dementia LES. We approved the Broom Lane extension proposal. We agreed some changes to LES and uplift payments and the extended access proposals. And we received an update and had quite a long and useful discussion on primary care network delivery to date. Happy to take any questions.
Okay, any questions for Janet? Okay. Engagements and comms subgroup, Debbie.
Again, a bit like Janet was just saying, Chair, that these are from January's meeting, but looking at the minutes, I'm happy for anybody to ask any questions, although obviously that's quite a while ago now. During the meeting, we were looking at the ICS engagement strategy, what was being proposed, and thinking of ways that we can inform that strategy as it's being built with as many voices from Rotherham as possible. And we have taken that to a PPG meeting since that meeting. I had some positive feedback. And obviously we were looking very much, as we always do, at the mental health and support that we give to the Rotherham Place. There is to be a refresh, and I think just to remind people, I think it's next week, it's International Mental Health Week, and we're having another relaunch of all our mental health services in Rotherham during that week as well. So we were talking about all of this back in January, but I'm happy if anybody got any more questions about that, I'll just take them.
Okay, questions? No.
Okay.
Any delivery board? Chris? Sue? Anybody?
It's
No?
just it's the same as before. It's a system pressures piece, Chair. It's just that's the Rotherham lens on it, but it's the whole urgent system is the key theme of the agenda. Anything
from HEG while you're on, Chris?
So the Health Executive Group, sorry, I should rather than use acronyms, Health Executive Group for South Yorkshire. So that the meeting's now finished now in its current form. So these are the minutes just there. So there's nothing to highlight on them.
Okay.
Take the questions if anyone's got any.
And members, Jeff.
Yeah, again, I think it's January minutes, unless anyone's got any questions specifically asked. I think there's nothing particular in there, I think that's like new.
Okay. That's fine. Okay. Well, that brings us towards the end of the meeting. There's no other urgent business I've been notified for. There's nothing being raised we need to escalate. Is the Ockendon stuff on the register? I think, is that relevant to us in terms of on our risk register?
It's not on the risk register because we haven't raised it as a risk. It's probably on other areas risk register, depending on issues that were current at the time. That's not why I got my hand up.
We don't have any live risks on maternity to report. Yeah, Ockendon will give us further assurance or not, depending on the outcome. So I don't think we need to escalate anything as a result of that conversation.
Okay. Sue, hands up as well.
Yeah, I just wanted to remind everyone that it's International Nurses Day on the 12th of May, celebrating how wonderful all the nurses are. And I do like to mention it every year when it comes around, because we do have nurses not just in hospitals or GP practices, but we've got nurses in commissioning, we've got nurses in public health, and it's a celebration of nurses, not to the exclusion of others, but a celebration of nursing.
Okay, I think we all would want to celebrate nurses. It's a bit like anything that you'll have one day celebrating nurses and the other 363 days to celebrate doctors. That's about right. Okay, fine. That I didn't see anybody else's hands up or anything. In which case, we'll bring the public meeting to an end. We need to exclude the members of the public from the next part of the meeting because to say that representatives of the press and other members of the public are excluded from the range of this meeting due to the confidential nature of the business to be transacted, publicity on which will be prejudicial to the public interest. And that is our last formal public governing body, except we have an extraordinary meeting to sign off our final accounts. But yes, we will meet again at 5 to 2 for the confidential board. Thanks, everybody. Thank you, David, for your contributions as you don't come to the private board. And I'll see everyone else back in 10 minutes.
Bye.
Thanks.